Hello everyone, I hope you all are doing well. So today we will start the topic of the Glasgow Coma Scale, and here it means it actually help in measuring the level of the consciousness after the brain injury or any kind of the trauma. In Glasgow Coma Scale, we are measuring by these three criteria: eye opening, verbal response, and the motor response. Motor response is also known as the muscle activity. We can also say the muscle activity. We are measuring the muscle activity of the patient, right? So in eye opening, we are measuring the patient condition. In this, like if the patient is already spontaneous, like he is already active, we can say active, or he is lying in the bed and he can able to see you when you are entering the ward or near to his patient bed, right? So we can give the score of the 4. And if the patient is respond to the sound, like when you call his name, then he is responding, then we will give the score of the 3. And we should be assured that patient should not be at the time he is not sleeping, right? So we should be like aware of that one, or we should like already tell the patient about that one, right? So now next, if the patient is responding after giving the pressure, like normally we are giving the chest rub, right? After the chest rub, if he is responding, then we will give the score of the 2. If neither of all these things, if he is not responding anything, then we have to give the score of the 1. So this is for the eye opening only, right? And the highest score in the eye opening is the 4, and the lowest score in the eye opening is the 1. Now we should come in the verbal response. In verbal response, if the patient is giving response like oriented, like I already told you, like the patient is like okay, he is oriented, like he is knowing all things, like you can ask the patient all these things, like what is your name, where are you, what the time, and like you can also ask the color of the patient t-shirt, pant, or something like that one. If he is like giving all things correct answers, then we can say that the patient is oriented. If he is confused, then we will give the score of the 4. Like if you are asking what's the time, then he is saying like blue or something else, then it means that the patient is already confused, right? And if the patient is like saying some words, then we will give the score of the 3. And if the patient is responding for sound only, like ah, like the pain, like the ah ooh, something like that one, and nothing else, then we will give the score of the 2, right? And if nothing he is responding verbally, then we will give the response 1, right? Now we will come to the motor response or the muscle activity, we can say. And if the patient is obey your command, like if you said okay, move your hand forward, lean forward, something like that one, and if the patient can able to obey your command or move your fingers or anything else, and he can move, then you can give the score of the 6, right? And if you are like giving the rub, or if you are pinching, you can say, if you are pinching in the finger, and then you ask in which finger, like I already pinch you, and if the patient is able to localize that thing, then you can give the response of the 5. And if you are pinching, right, and there is a normal flexion, like he is removing his hand from there, like if you pinch in the forearm and he is like flexing his hand, then we will give the score of the 4. And this is called the normal flexion or the withdrawal, so don't be confused here. So many questions are coming from here only, like sometimes they are saying withdrawal in the question, sometimes they are saying flexion while pinching. So don't be confused, right? Sometimes it's happened they are like confusing by giving these some different words to confuse you all. Now, if the patient is behaving like the abnormal flexion, what's the abnormal flexion? Like if you are pinching in the forearm and he is like flexing the leg, so this is called the abnormal flexion, and you can give the score of the 3. And if you are on pinching, if he is still in extension, he is not responding, like he is extending his arm and more, not even flexing, but like showing some of the response, right? It's not like that no response, there is a response, but it's not flexing, it's extension. So it means that we have to give the response of the 2. If there is no response on pinching, then we can give the response of 1. It means no response, right? So this is the very important table. We should have to remember this one, because this from this table only so many questions are coming in a different medical exams, right? So now how we will get to know that it's like normal score or what? So right, if we will calculate, if it is a coming 13 to 15, and then we will call as the mild. If it is coming 9 to 12, then we will call as the moderate. And if it is coming like a 3 to 8 GCS score, we called this one as the GCS score, right? GCS score. So if GCS, like for example, I can tell you, like if the score of the E4, right? E4, we have to write like this one. So like you have to learn this one also. E4 V5 M6, V4 V5 M6. So we have to add all these 4 plus 5 plus 6, so it should become like 15, right? 5 10 and this one total will be 15, right? GCS, so we will go GCS is a 15, like it's okay, mild. Mild means like it's okay, nothing problem. But if the GCS like this one, if we will call that E1 V1 and M1, so total is the 3, right? 3. So this one is the serious. If the GCS score is coming 3, it means the patient is already died. So this one is very important, we have to know this one very well. So sometimes in the exam the question is asking like this one, what the mild Glasgow Coma Scale, and they are giving this option 13 to 15, 9 to 12 or 3 to 8. So we should also have to remember this one, very important. Like mild criteria is from 13 to 15, moderate is 9 to 12, and severe is a 3 to 8. So don't worry, we have we will solve so many questions to know this topic more well, very well, and not to be confused in the exam, right? Now, sometimes in the exams uh, sometimes in the exams they are giving the questions like this one, like here I am telling you, like here, if there is a trauma in the face and eye is swollen, right? Eye is swollen and we cannot able to test, right? We can't able to test the eye. So how we can write this one? So no need to worry, like we not have to put this one is like 4 e4 e3. At that time we can put here like ent. Ent means non-testable. Nt means non-testable, right? So nt. So remember this one. If there is a trauma or something else, if we can't able to test, if we can't able to test, then we will put the nt. What the nt means? Non testable, right? Non testable. Now here, sometimes what happen, sometimes like we are examining the patient, right? And this is the uh, upper arms and the lower arms, right? Lower portion of the patient. Sometimes there is like 3 by 5 uh, muscles, or what we call that motor response or the muscles activity in one arm, and in another arm is like 5 by 5 or 4 by 5. So always what here we have to remember, if a variable response means like somewhere is a 2 by 5, here is 1 by 5. So like this one, if in two sides, if a variable response is coming, in this case we should choose the best response. So what's the best response? So best response here is the 5 by 5 or 4 by 5, right? And here in the lower portion is the 2 by 5. So we have to choose the best option, right? So don't be confused in this case. Sometimes they are giving like that one, like in the right arm, in the right arm there is a 3 by 5 muscle activity or the movement of the muscles, and in the left arm or left sided it is a 4 by 5. So don't be confused, take the most appropriate or the best response in that condition, right? Now we have to solve some questions to know this topic very well, that we are knowing very well or not. So let's examine our knowledge, whatever we learned till now. So here what it is written, ki calculate the GCS of the patient exhibiting the eye opening on pain. What it is written? Exhibiting eye opening on pain. So let's go up and let's see. On pain, on pain, on pain the score is 2, right? Exhibiting eye opening on pain, so we can write here on pain it is E2. On pain, conscious but confused. Here see, he is saying conscious but confused and cannot tell the time. So let's see, confused. Confused means 4. So we can write here V4. Now M. What for M? M and exhibit flexion. Exhibit flexion on painful noxious stimuli to the arm. So let's see. Okay. There is no abnormal flexion. There is no abnormal flexion. So we should not write the 3. Here he is saying, right? What he is saying? He is saying flexion. Exhibit flexion. He is not telling normal or abnormal. So we should consider it normal. So normal flexion means withdrawal. It is a score of 4. So we will write here 4. So what's the GCS score? So total GCS score is 10, right? So here the option is giving 8, 9. So the correct is 10. It's so easy, right? And this question already came in FMG 2019. So let's try the another question here. These are easy, I think. We already learned all things. So I think these all are the questions which are easy only for us, right? What are the three components? Here he is asking components of the Glasgow Coma Scale. It's very easy, right? We already learned that it's what? Try to answer. E3, V4, M5, right? The answer is the C. There is no memory, there is no pain, right? So the answer is the this one, third one. Now next question. Each of the three component of the Glasgow Coma Scale have a number of steps. Which of these are the correct combination? We already learned already, like what? There are three components, right? Eye, verbal, and the motor. And what? How many eye? In eye, how many conditions are there? There are four conditions, right? E4, V5, M6. It's so easy. 4, 5, 6. No need to learn. There is no any logic. So 4, 5, 6. There is 4, 5, 4, 6. It's wrong. 4, 5, 5. This is also wrong. And 4, 5, 6. So easy. What possible sequence of responses is assessed in the eye component? So he is asking only for the eye, not for verbal, not for motor. So in eyes there are four components, right? Four components. So he is asking about those four components. So those four components are what? Spontaneous to sound, to pressure, or none, or spontaneous, none, to pain, to sound, right? Or to pressure. This is the wrong sequence. This is the spontaneous. This is also wrong, and this is the correct. For spontaneous, we are giving 4 score. To sound, 3 score. To pressure, we are giving 2, and none means dead, right? In each component of the Glasgow Coma Scale, the best response is. So what is the best response? No response means 0, right? No response, patient is already dead. So no. Spontaneous is correct because we are giving the highest score. What's the highest score in this one? So it's about the Glasgow. So for everyone is different. Like E4 is the highest, V5 and M6. So remember like this one, 0, 1, 2, 3 and 4. So 4 is the highest score, and highest means good, and 0 is the lowest score, and it means bad score. And bad score, and if we all are getting like the lowest lowest number, like there is no 0, sorry, not 0, but from 1 only. From 1 only, if 1 E1, E1, V1 and M6, M1, I already told you 1 plus 1 plus 1. If it is coming like a 3, it means the patient is already dead or in coma. Dead or in coma, right? So lowest score. So remember this one, the lowest score is not 0, right? Remember this one, they will confuse you. The lowest score is 3, right? Remember this. Okay, let's solve the another question. A patient fell while rock climbing, right? I already told you this is what is the GCS. GCS is for measuring the consciousness of the patient while the brain injury or any kind of the trauma. So here also he is saying that patient fell, right? So might be there is injury in the brain, so we will assess that one. When you apply a deep external rub means we are giving the stimulation, and stimulation, or we can say that we are giving the pain to the patient. He उसने क्या किया, extend किया his arms and legs, and shows no other response. He is not showing any other response. And then he is asking what is the Glasgow Coma Scale, right? So first of all, we have to see the four components and its eye and the muscles, or the mobility of the muscles, right? So here we have to see that he is saying that no other response. No other response means E0, E1, sorry, I am E1. See, I am still confusing. So don't be confused. So it's E1. And here, when you apply a deep external rub, he extend his arm. He is not flexing, he is extending. So what the extension? Extension is 2. So 2, so we have to write the M2. And what about the this verbal response, or vocal, we can say vocal or the verbal response. So here he is saying that no other response. No other response means still we can write V1, not 0. So don't be confused. Not 0, right? So if we will calculate this one, 1 plus 1 plus 2, it's 4. So here GCS is 4, right? And here, what is the Glasgow Coma score of the patient who is pulseless? See, this is the most important. Here you will confuse, and here you will say that he is not giving any of the criteria like eye is open or eye is closed, or while we are giving any pressure, then only eye is opening. Nothing, no movement of the. He is just saying, he is giving a big like hint, pulseless, like patient is already in died position, right? So what I already told you, in died position the patient GCS score is 3. And if we can write this one, so it will be like what, E1, V1 and M1, right? So this one is the answer for this one. Okay, one more thing I have to add in this one, like sometimes they will ask the GCS score, like here, right? GCS score is 10. Now they might ask you that this is a mild or moderate or the severe. So it's the 10 score. So 10 score is coming here. So we can say it's in moderate, right? So be careful what they are asking, and we have to give the answer according to that. Okay, so I hope that this topic already I told you in a very well manner, and I hope there will be no any confusion in this topic. So thank you for watching this video till this on the end. And please, this is the my first video, so I hope that you will support